To day 3 of the federal government shutdown. Today, the Senate tried and failed to pass a short-term bill to reopen the government.
Yeah, Majority Leader John Thune says there will be no more votes this weekend, and that means the shutdown will extend into next week.
And this comes as the White House is preparing to take the unprecedented step of firing thousands of federal workers and making program cuts that primarily affect blue states. Keep in mind, while negotiations between Democrats and Republicans are at a standstill, lawmakers are still getting paid, but federal workers say they're the ones caught in the middle, and they're worried about the financial strain of a long shutdown.
I think one of the biggest concerns isn't so much today, tomorrow, but it's what's going to happen in 2 weeks.
Republicans say they are willing to negotiate with Democrats on Affordable Care Act tax credits, but only when the government reopens. As the federal government shutdown continues, concerns are growing about health care costs for people enrolled in Covered California. Enhanced premium tax credits that have decreased premiums since 2021 are set to expire at the end of the year.
It's now a key sticking point for the budget talks in Washington, D.C. ABC 10's Austin Castro breaks down what local leaders are saying and what this could mean for people here.
More than 1 million Californians could soon pay much more for health insurance under Covered California. That's the warning from the agency as they now call on Congress to extend federal premium tax credits that are set to expire.
We estimate as many as 400,000 of our current enrollees will be forced to drop coverage as a result. And that is not the only impact. Those that remain will pay more.
Covered California Executive Director Jessica Altman adds, on average, consumers will see premiums nearly double without those federal tax credits being renewed. While the future of this enhanced federal tax credit remains uncertain, there's also a looming November 1st deadline. That's when open enrollment begins for Covered California.
So unless Congress acts really right now, we have to move forward with an open enrollment based on that expiration. People will get those letters. People will make really hard choices about their health insurance.
In the event that Congress acts after November 1st to extend that tax credit, Covered California said they would revert back to the 2021 premium. This extension, ultimately involving the Affordable Care Act, is at the center of the federal government shutdown as lawmakers remain at an impasse. Sacramento Democratic Congresswoman Doris Matsui joining Covered California officials Friday, calling for that tax credit to be extended.
This shutdown is a direct result of Republicans putting themselves and their political agenda above the people that they are elected to serve. Democrats will not let that stand.
Republican Congressman Tom McClintock argues these demands on health care should not be keeping the government shut down. He goes even further to suggest the credits shouldn't be extended, and we need to reevaluate the federal dollars spent on this.
Allowing these subsidies to expire would simply return to the original Obamacare premium levels. For example, a single individual earning $40,000 a year will still only pay $2,700 a year for health insurance, with taxpayers picking up the other $5,400 of that cost.
In Sacramento, Austin Castro, ABC 10.
Now, according to Covered California, middle-income Californians making more than $62,000 annually would pay about $500 more a month if the subsidies expire.